Good morning.
Good morning.
We're the CHRISTUS Midwives, and we welcome you to our little session this morning. We're going to cover pediatrics and some more breastfeeding information for you. We're glad you're here. You can easily access this later. There's going to be a link up on both the CHRISTUS website, also our Trinity Midwifery group Facebook. We ask for you to make sure that you mute yourself, and then also we'll have questions all at the end. So right now, this is Jacqueline.
Hey guys, welcome back.
Dion.
Hello.
And I'm Selena. And I'm going to turn y'all over to the CHRISTUS Trinity Clinic Pediatricians, which are excellent. They're the best people in East Texas to take your baby to. My patients love them. So I'll let them introduce themselves and tell you a little bit about themselves, and then they'll talk about the process after you have a baby.
Okay. Hi, I am Tiffany Turner. I'm one of the pediatricians here along with Dr. Coda. I have been in Longview. It will be 6 years in November, right around Thanksgiving. I am born and raised in Dallas, and I went to college in New Orleans and did my medical training in Nashville and did residency in Austin before I came back. I've known I wanted to be a pediatrician since I was 5 years old, basically because I like playing with kids. And so it's kind of the same way I like playing with kids, but also taking care of kids and seeing them grow up from being newborns to teenagers. And so it's just a lot of fun.
Hello, I'm Sanjeev Koda. I'm one of the pediatricians with CHRISTUS as well. I've been in East Texas for about the last 10 years or so. And I trained in the Midwest, Indianapolis and then Toledo. And then since finishing training, I think East Texas has been home for the last 10 years. Very excited to work with kids. It's definitely a calling, and I think it's very obvious that you enjoy what we do, and it's fun to take care of kids. It's fun to see them grow, and we're always excited to take care of kids here in the office. So Dr. Turner and I are the only two pediatricians here. You'll no matter what it is, you'll see one of us, and if one of us is out for any reason, we cover for each other. So we're very excited that we can provide this service in East Texas.
The process of being delivered at the hospital. So if you guys are delivered at Good Shepherd, whoever delivers you, Dr. Coda and I do take newborn call along with another small group. And so one of us will be seeing you. We will see you within the first 24 hours of being born, and then we see you before you're discharged. And that process is just us coming into the room. We will listen to your baby's heart, lungs, and then we're monitoring the weight before you guys go home and answer any questions that you have initially. Typically, you will go home within 24 hours, around 24 hours if you were a regular vaginal delivery. And then with C-sections, you go home around 48 hours unless there's complications. And so during that time when you're in the hospital, like I said, we're checking your weight. We're seeing how baby is eating. We will also be checking what's called your bilirubin level, which checks for jaundice. And you'll hear people talk about the skin being yellow or the eyes being yellow. And so that level is also checked while you guys are in the hospital. If you have a little boy and you choose to be circumcised, you will be circumcised the day of discharge. And so right before you go home, your baby will be circumcised, and then we'll send you home, and we will follow up in the office and see how that is.
Yeah, I think to add on as well, we have really good lactation help at the hospital. So moms that like to breastfeed, make sure you get all the help that you need. Not that you can get more help afterwards, but you have somebody that can constantly help you through the hospital stay. And then once you do get discharged, possibly the same lactation consultant could meet you again and help you more with the breastfeeding part. I feel like those first 24, 48 hours are very precious. You have a lot of help in the hospital, so it's good to ask tons of questions. We come by around on the baby as well, so any questions you have, we're always happy to answer. Any of the nurses can reach us at any time, so feel free to contact them and have them reach out to us as well. For the most part, once you get discharged, we like to see you guys here in the office within a day or two of discharge. It usually depends on a bunch of different things, but it could be the weight, it could be the jaundice, and then that kind of tells us how soon we need to see the baby in the office. It's continuity of care, so you get to see the same person here in the office as well. Once you come in, there's multiple visits within the first month, so you do get to see us very often. And any questions that you have, obviously, we're happy to answer as well. So once you leave the hospital, typically you've received, majority of that first couple of days of care, and then everything we do here is follow-up. And as needed, we'll get you guys back to lactation if you think is necessary, or if there's any need for that. But majority of everything is, each child is different, each baby is different. So once we see you here for follow-up, we'll schedule everything accordingly, and then help you guys through everything that you need.
So like Dr. Cota said, we typically will see you guys day 3 to 5 of life for the baby. Our process is, so when you come into the building, just like when you guys went upstairs, they'll check your temperature. You'll come into our office. We're on the first floor, directly across from the emergency room. So when you come in and check in with the front desk, they will check you in and then bring you right to one of our dedicated newborn rooms. So this is my newborn room. Dr. Cota also has a newborn room on the other side. We only see newborns up to typically 2 months in these rooms. We don't see any sick patients in this room, so this is what we consider one of our clean rooms. This room does have its own scale, so you have the same scale that's being used to track the baby, to track your baby's weight. You'll be brought right in, and then one of the nursing staff will come in. They will ask questions regarding your pregnancy, regarding the delivery, and then just seeing if you have any general questions. And then at that point, they will get all of your baby's vital signs. So they will get a heart rate, a respiratory rate, will get a weight to compare the weight to the baby's birth weight. And then they will get a length to see how long baby is. And then after that point, Dr. Cota or myself will come in and discuss with you. I think the biggest thing about the first 2 visits, because we will see you within that first week of birth, and then we see you when the baby is around 2 weeks old. I think the biggest thing is, especially if you're a new parent, you have a lot of questions. And so that's what we're here for. And so I typically will tell my parents to either put it in their phone the minute you think about it, because you will forget by the time you get here, because you're usually very tired that first visit, or to write it down in a notebook so that you can ask the questions. That's what we're here for. And so we'll answer any questions that you have regarding your baby in those first couple days, if there's anything you just aren't sure about. And then we will see you usually around 2 weeks. If for some reason your baby is having problems with eating, or we're worried about the weight, we will see you back usually within a couple of days to get another weight check and then make sure everything's going okay at that time.
So one of the questions I know a lot of new parents have is, what happens if you have an emergency after hours?
I can do that. So we have an after-hours nursing service that answers the phone. So you would call the same number that you would to call the office, and you get a RN that answers the phone. And and they have a protocol based on which they would answer your questions. And they can always reach either one of us at any given time if they have further questions. So 24/7, there's somebody that answers questions or concerns that you might have. And one of the benefits that we like about this after-hour service is that they can schedule an appointment for you for the following day. So let's say you said, you're concerned about baby's feeding or something like that. They can put you on the schedule, whatever time you call them, for us to be able to see you the following day. So you don't have to call us the next day and make that appointment. And I think it's a service that we trust, and these nurses are constantly in touch with us. Anything they need, they know they can they have access to reach us. So I think you'll always get care when you call that phone number.
And it's always Dr. Cota or myself that take call for the office. And so you'll always be able to talk to a physician, and it's always one of us that talk to each other. And so we always see each other the next day, whether it's texting each other or giving each other just verbal saying that your patient called, so that we know. And then you will get a call back either from one of our nursing staff. One of the nurses will give you a call back. the next day if you didn't make an appointment, just to make sure you don't have any additional questions and that everything's going okay.
Another question that's really frequent with new parents is, what is the immunization schedule?
So the traditional immunization schedule is vaccines at 2, 4, and 6 months of age. Traditionally, so our vaccines that we give at those first 3 visits are going to be an oral rotavirus that baby drinks, and they typically like it because it's sweet. So they have an oral rotavirus, and then there are 3 injections. And so you get a vaccine for hepatitis B. Most people will get the first hepatitis B in the nursery within the first 24 hours before coming home. And so we will give you your second and third ones at the 2 and the 4-month visit. You also get a vaccine for pneumococcal, which is a bacteria that causes meningitis and ear infections and blood infections. And then we have a combination vaccine that has your DTaP, which is tetanus and whooping cough, polio, and HIB, which is Haemophilus influenza. It's a bacteria that is notorious for causing meningitis. And so that's the traditional shot record or shot schedule. I will say I know it's very nerve-wracking when people talk about vaccines. I will say 99% of my patients who have gotten vaccines have done very well with them. They do get their shots. They do cry. Babies are very resilient, though, so they will only cry for about 60 to 90 seconds, and then they're good. And then you put them in the car seat, and you guys will go home at that point. But if you have any concerns or questions during the visit or before the visit, you can always ask Dr. Coda or myself.
What about if new parents wanted to meet you before their babies were born? Do you do consultations, and how do you get that set up?
Yeah, we have a lot of parents that actually come and meet us prior to having the baby. We typically just have you guys call the office, or if they see one of you guys upstairs, we can always set it up to where they can come talk to us. They can tour the office, and then make that decision as well. So we do that very frequently for parents.
I will say for my friends who, I wish I had the book, for people who are new parents, there's a very good book called Baby 411 that you can buy on Amazon. It is a super easy read. It goes through a lot of the basic questions and concerns that people have with newborns. There's even a section in there discussed that's called Choosing Your Pediatrician. I can say personally for myself, I think for myself and Dr. Coda, which is why we work well together, we practice very similarly. But I think a lot of what goes into picking your pediatrician is personality, because most pediatricians do practice the same. We follow all the same guidelines. A lot of times it comes down to personality. And do you get along with your pediatrician? Do you get along with our nursing staff? Do you feel comfortable going into the office? Do you feel comfortable talking to them? I think there's a lot what goes into picking a pediatrician.
Right now with COVID-19, what are y'all's guidelines as far as patients coming into the clinic?
So it's sort of a broad question, but what we have typically done here in the office is there is multiple layers of screening, where if somebody calls us, we ask questions about COVID or exposure. If they are having symptoms, we have specific protocols on how to handle those patients. One of the benefits we think too is that we have a sick and a well waiting room that are separate from each other. So that kind of helps us as well. But I think with Trinity Clinic and Trinity Pediatrics, we follow all of the CDC guidelines of screening people that come through, essentially coming through this building, and then anybody that enters our office. So we require that everybody wear masks. Per the CDC guidelines, we check everybody's temperature when they walk in, before they come through the building. And then we also have our own office staff that calls and screens every one of our patients that comes through.
I think for our staff, we all of the staff go through daily screening, so everyone does temperature checks every day. When you come in office, we all wear masks all throughout the day. we are very good about trying to prevent people from sitting in the waiting room. We bring you right back to the rooms. We take time between each encounter to clean the rooms thoroughly. The tables are cleaned, everything is cleaned between all visits.
One more question. What age does a child have to be before you don't see them any longer?
I think it depends, right?
I know. So I like seeing I don't like giving my kids away. I do. I like seeing them graduate and go off to college. And so I would say our cutoff is usually 19 to 20. I will have kids that will go to college in the area, so I will typically continue to see you through your first year of college because you can usually come back during the holidays or if you're sick. And then we will if you guys don't have a family practice provider, we will refer you to one of the CHRISTUS family practice providers in the city to see.
I'd say the same. I think it ranges from about 18 to 21, just depending on the child, and each situation is a little bit different. But yeah, we do our best to see them as long as we possibly can and help the family.
Does anyone have any questions in our audience?
Do y'all offer an alternate schedule for vaccines?
So it's not that we offer one as much as if the family would like to do it, spread out the shots or do 2 today, 2 another day, whatever they want to do. We typically will work with them. There's not necessarily a schedule that we would provide, but if they came in and said, baby needs 3 shots today, we would like to do 1 this week, 1 next week, 1 the following, we'll be happy to do that for them. If they want to do 2 today, essentially we try to work with the family and make it work for them.
If you had one important thing to tell new parents about having a baby or how to take care of a baby, what would it be?
I do
right?
know. Well, I will be honest, I do not have children, but I have a niece. But my biggest thing with mothers is 1, breathe. 2, babies are very hard to break. So you are doing fine. That's all. You are doing fine. 3, happy baby equals happy mama, which equals happy life at home. And so, if you feel like you want to breastfeed and it's not going okay, for you to give formula is not wrong, because your baby will be happy and you will be happy. And then you guys will all be happy. And then it sounds ridiculous, but sleep when your baby sleeps. Because I see a lot of mamas who will stay up while their baby is sleeping or will be looking at the baby and they're worried, and you need to sleep also. Rest is very important. So I would say make sure you're getting enough rest and sleep when you can, and stay hydrated. Yes.
Okay, there's one question
Yes.
from the audience. That is, will we schedule the first appointment with the pediatrician after the birth?
So yes, because you don't know how long you're going to be in the hospital. So typically, most people will end up calling right before they're discharged from the room, or when we see you, we'll tell you, okay, you're doing great. We'll see you in 2 to 3 days, and we'll tell you to call. So people will call once they get home and call and get on the schedule. Your advice.
Oh,
you have children.
That's right. Yeah.
Give some dad
I know, right? Well, yeah. we have a couple of kids, a 6-year-old and a 1-year-old. I think essentially what Dr. Turner said is very reasonable. In the very early part, when you come home from the hospital, it's very important that mom and baby are both happy, and breastfeeding and some of those can be pretty stressful at times. So please try to use all of the resources that you have, get help, and we're all here to help you. And I think it's better as long as doing a little bit of formula, like Dr. Turner was saying. Those things are very minor when you think about it. So we want mom and baby to be comfortable, happy, and do well. So with having 2 kids, I tell you, I think as parents we're doing our best, and it's very rewarding, and we all enjoy doing it. So I think it's fun, and it is stressful, but it's fun. So I think that's two of our experience. We have two now, so I think they both kind of gave us the same kind of experience so far.
So babies can't be broken, but maybe parents can.
Sometimes.
We have some questions for you.
We have another question. On average, how typical is it for a baby to develop colic? Factors that cause it that mom could avoid to help prevent the baby from developing it.
I think it's sort of colic's a hard, specific. It's hard to give specific answers about colic because each baby is different. And one of the things we try to tell parents is that colic typically is not something you see in the first week of life. It's something that should show up later in life. If it's going to happen, it's about week 3-ish. So we don't want parents to be concerned that pretty much everything that you see could be colic, because usually it's not. And if there is, and baby's having symptoms that are like colic, then there's certain things you can do to help the baby. There's some drops you can use, some bright water, different things, Malacon drops. But most of those, none of them are certain. Nothing says that this is going to help the baby for sure. So I think it's worth trying, but it's also good to have a less of a stressful environment. If mom and baby tend to be happy, that helps with some of that colic and those situations as well.
I think that's the biggest thing is babies do pick up on stress in the environment. And so I think one of the biggest things is trying for you, I know it can be difficult, but you staying calm and trying to keep the baby calm. There is a guideline called the Happiest Baby, and they talk about the S's as far as keeping your baby for colic. It includes swaddling. Some babies love to be swaddled tightly. Shushing, which is a very loud shushing sound, and swinging are three of the things that people will talk about as far as colic. There's not really a rhyme or reason to colic. Every baby's colic is caused by something different. It should not be seen immediately at delivery. We usually see it 3 weeks to 3 months is when it starts. And we just try to figure out the best way to calm your baby and keep them happy.
Any other questions out there?
Doesn't look like there's any posted at this time.
Okay, I have one more question for you to answer. Is Paula already on there?
She is.
Okay, so the last question I have is that women struggle with postpartum depression at some times. And one of the responsibilities of the pediatrician is actually to help screen for that and refer them if they need it. So how do y'all do that? And how are y'all available to help mothers who are struggling with that?
I think from our end, we will ask, the nurses will ask and see how the stress level is going. We will discuss it with you and we will tell you, we will typically refer you either back to your OB, or if you have who are typically very comfortable with treating postpartum depression, we will also discuss with you getting a counselor, trying to find a counselor, or if you feel like if it's stress, if you have any help or somebody that can help take on that load.
I think that's the biggest thing is being, we ask about it at every visit that you come in with the baby, especially initially when you expect that. And we're always happy to talk to you about it. Although we can't necessarily treat it, we will know which direction to point you in, get you in touch with your OB doctor, get you some help with counseling like Dr. Turner was saying. But we're definitely a resource and we want you to be able to bring that up at any visit that you come and see us. And we'll do everything we can to help you guys.
Can y'all think of anything else that you want to share with them?
No, I think the biggest thing is I love seeing newborns. I do.
That's the best part of peds.
I know it is. It's like the best part of peds is seeing newborns and also seeing them hit their developmental milestones. I love when a baby comes in and rolls over because they, and parents haven't seen it. They wait to do it here, or seeing babies, when we see babies from newborns and they walk in the office, it's really fun. I love seeing it. I love that part of being a pediatrician.
Right.
And so I think the biggest thing is just you guys, being happy during your pregnancy. I think it's a great time. You'll be tired, but it's completely worth it. And just enjoying it. And, if you guys pick us or you have any questions or you want to come visit us, feel free to come in, make an appointment, stop in, say hi. You'll get to meet us. You'll get to meet some of the nursing staff. You'll get to kind of look at the office and see if we're a good fit for you.
Yep, we're definitely excited to meet all of you. Have you come bring your babies up here. Yep.
We appreciate y'all coming and
Thank
sharing with
you.
them. It's good
Thank
to
you.
see you
Good to
as
see you.
always.
Thank you.
One of the things that you need to remember as a new parent is open communication. Communication between all your healthcare providers, because here at CHRISTUS we're all a team and we're here to support each other as well as you. So if you have any other questions about pediatrics or being able to choose them as your pediatricians, please feel free to call their office. And just to clarify, their office is located at North Park, right beside the ER on the first floor. Our office right now is upstairs from that. So it's kind of like one-stop shopping if you're coming to see us and them. It's a great alternative for you. So now we're going to switch over to breastfeeding with Miss Paula Hyatt. She is ready to give you some more information about the next phases of breastfeeding, and she'll be open to questions after she's finished.
Hi, I'm Paula Hyatt with Lactation Services. I'm actually here in our lactation center that is located in the Medical Plaza right here on Marshall Avenue across from the hospital. And I know last time we visited, I didn't have any video, so I'm glad I figured it out this time for you guys. What I wanted to maybe talk to you a little bit about this session was that first several days, usually day 1, day 2, they happen in the hospital. And for many moms, that getting started is so key to establishing a very effective breastfeeding relationship with your newborn. A lot of moms get concerned because if you think about the process of birth, it is exhausting for the mother, but it's also super exhausting for the baby. And oftentimes, the very first thing they want to do as soon as they're born is just sort of relax and just chill out against mom's heartbeat. And here at Good Shepherd, we call that heart-to-heart time. You'll also hear it called golden hour, things like that. But as far as helping the baby to transition from that environment of the womb to this new environment of the world, that time is super important. What we also know is that if we give the baby that snuggle time, that time to just learn mom from the outside instead of the inside, that the baby's ability to focus on mom as far as feeding is so much better. So some newborns are born and they immediately want to latch. It's like we can't even get them dried off and the cord cut before they're wanting to latch. Some babies are not that assertive as far as wanting to feed. Some of them want some heart-to-heart time with mom. And if that baby can just spend 30, 45 minutes snug, skin to skin with mom in a nice, warm, calm, quiet environment, then their feeding behavior begins to develop. And we see them begin to root and to search. So if the mother is concerned that her baby didn't immediately go to breast, then of course she begins to feel a little anxious, because as the mom, the first thing we want to do is make sure that the baby has everything they need. And for us, that really means food. So we feel reassured, and the nurses are going to be there to reassure you that the baby is doing well if they are needing some downtime before they're ready to eat. The other thing that I want to keep in mind is that sometimes that very first feeding is an assertive feeding, but sometimes it's more like a meet and greet. Hi, how are you? This is where the groceries are stored. And they lick and they touch and they taste and they latch for a few minutes and then they get still for a few minutes and then they taste again. And this is also a normal type of newborn feeding behavior. So if you thought that everything was going to look like the newborn channel, right, off of Lifetime Network, and the baby just pops out of the uterus, hops on the breast, and eats like gangbusters, it's not going to happen that way for most babies. And so we want to reassure mom that calm and slow introduction to the idea of breastfeeding is perfectly normal. The other thing to keep in mind is babies will have a very active period, maybe sometimes that first hour after they are born, but then they can drop into a deep sleep. And so they may nurse well at birth, and then the next couple of feedings, they're really sleepy and they're very tired and they're not very assertive. That has nothing to do with whether they're getting enough to eat or not. It has to do with the normal recovery process from being born. There are things that we know will help. We know that skin-to-skin time before feedings helps, and we talked about that a little bit last session. We also know that having plenty of support from mom as far as physical support. Is mom comfortable? Have we got enough pillows for mom? Have we got something she can rest her elbow on? Have we put the bed in a good position? You know, did mom have a chance to get up and run to the bathroom so she's not trying to feed her baby with a full bladder? That's miserable. Did mom have a chance to maybe wash her hands, get a sip of something to drink? So ladies, be sure that you take care of yourself as well as taking care of your baby, and that will make your breastfeeding better. The other thing is that other support person, and it's a village effort. So you may have the lactation consultant who's able to help you. You may have your nurse that's assigned to you and your baby for that shift. They are very qualified to help you. You've got maybe a significant other, whether it's baby's father, a close relative of mom, someone who is also there to be that extra adult, that second set of hands. Sometimes I say frequently to moms, it takes 2 grown adults to breastfeed 1 newborn, and there's nothing wrong with that. Sometimes in our society, moms have this feeling that, you know, you got to be the super mom. You got to do all the baby care, all the baby feeding. And in the process, you also need to load the dishwasher and wash some clothes and cook dinner. And gosh, ladies, what are we doing to ourselves when we falsely tell ourselves that we have to be able to do all these things and do them independently? So be sure that you pull in that circle of help, those folks that are going to be providing mom comfort and baby help. Those are super important. We also know that babies will have very, very small tummy sizes that first day of life. We're talking the size of a cherry, right? It's pretty small. And so 1 or 2 teaspoons fills them up. It doesn't take a whole lot of colostrum. I mean, let's think about colostrum as super concentrated survival food. It doesn't take but a teaspoon or 2, and they're feeling pretty satisfied. And then they'll drop off into a sleep, and they'll sleep for a couple of hours, and then they'll want another teaspoon or 2. And that's pretty much how day 1 of life works. They are not in tune to their own body signals yet. And so there's this theory that you will hear, and you hear it a lot from your grandmas, and since I'm a grandma, I can say that. We hear it a lot that says, oh, well, if the baby's hungry, they'll wake up. But during the first 2 to 3 days of life, it's not very accurate. They don't understand what hunger is. They've never had it before. They don't interpret their own body signals well. So where you and I might go, hey, you know, I'm getting kind of peckish. I need a little food here. The newborn doesn't quite catch on that quickly. So you will have to maybe unwrap them out of their swaddles, stroke their skin, touch their face, speak to them, put them skin to skin, so that they begin to be a little more aware of what's going around, and pretty soon they're going to, by the way, I think I am hungry. Now, what's really crazy is you spend the first day begging them, please wake up and eat, please wake up and eat, and then somewhere around day 2 or 3, you're going to switch, and you're going to be going, please stop eating and go to sleep. You've had enough now. It's over, okay? Because all of a sudden, they've discovered what hungry is. They've discovered they like food. They like feeling full. I mean, they want Thanksgiving dinner every single meal. And they will try to eat every hour, hour and a half, some babies. And moms perceive this close together nursing as, I don't have anything, they're hungry. But if we watch the baby's body language, they wake up, they eat, they nurse both sides, maybe 15, 20 minutes. There's no clock involved in baby feeding. Some babies are very fast eaters. Some babies are very slow connoisseurs. And so you average out around 15 minutes each side, give or take, but depending on your child. And then they fall asleep, and they sleep for an hour, hour and a half, and then they want to do it all over again. They're having wet diapers. They're sleeping between feedings. These are babies who are getting food. They've just all of a sudden discovered that yesterday they were too tired to tank up. Today, they're going to make up for it. And so they do have very close together feeds. And that's that second day syndrome. We actually have some information for our moms about second day syndrome, because we know that those babies are going to start spiking a little attitude as they get into that second day of life. Mom's milk begins to show up between day 3 to 5. And so a couple of the ways you know that the baby's getting more than just colostrum, getting more volume in their milk, is they begin to have more poop. And, if it's coming in the top, it's coming out the bottom. And that's the easiest way for mom to know, is my baby getting enough? So the stool starts out as that thick black tar, goes to sort of a green, darker color. But as you get to the point where the baby's getting a large volume of milk from mom, they begin to have yellow squirty mustard poop. Isn't that lovely? Every single time they eat. And so what I tell moms is, babies lose weight for several days, but when your baby gets to the point where they're having that yellow squirty mustard poopy diaper every time they eat, that's a baby that's gaining weight. And you'll see the babies space their feedings back out because they're getting larger volumes. Their tummy is ready for larger volumes. Instead of 1 or 2 teaspoons, now they're ready for 2 or 3 tablespoons. 3 tablespoons is an ounce. And so that is a pretty good volume for a baby at day 4, day 5, day 6 of life. The important thing is to just be consistent. Offer the breast each time the baby looks like they want it. Don't worry about the clock. Don't worry about, it's 15 more minutes before my baby's due to eat. If he's awake, he's alert, he's ready to eat, put him to the breast. In all theory, you are not going to overfeed your baby during the first 3 to 5 days of life. The other thing is, as we've said before, ask for help. And just to jump off of what the pediatricians were saying, the babies pick up on stress. They pick up on anxiety. Is there any way that I would say to you that learning to breastfeed is not a little stressful? I would not. I know for a fact learning to breastfeed with your first baby is a little stressful. You are not 100% sure what you're doing. The baby definitely has no clue what they're doing, except that they know they want to be attached to their mother. They love to be attached to their mother. So just be willing to go with the flow per se. There's things that we can do and the staff can do to make that a little bit easier. We can help you tweak how the baby is positioned, because oftentimes if your baby doesn't like one position that you've tried, they're going to respond more favorably to a different position. Maybe we need to lift the baby up into the breast a little more. Maybe we need to slide mother's hands back a little bit. Maybe we need to help the baby adjust where their chin is placed under your breast. These are things that second set of eyes, that's educated eyes who can look at mom and go, everything looks pretty good, but one thing might make it easier. That's what we're here for, is to provide you those hints and those tips and those little tricks, because we know that it's going to make things better for you. Also, you can see I'm here in the outpatient center. We have lactation center open 6 days a week, and sometimes on Sundays as the physician's request. But we see moms back here in the lactation center after discharge as many times as they need. If you need us to help you, we want to invest our time and our talents into you guys to let you be successful with your goals for breastfeeding, whether that's exclusive breastfeeding, partial breastfeeding, feeding pumped breast milk. These are all individual goals that mothers choose for themselves. And we, as your consultant, would love to see you choose exclusive breastfeeding because we know what the health benefits for your baby are. But it's not my goal that matters. It's your goal that matters. And so you come to us and you say, these are the goals I want for me, my baby, my family, as far as breastfeeding. And that's what we're there to help you to meet your individual goals and to smooth that pathway if mom and baby are struggling a little bit. So my takeaway before I open up for questions would be, don't expect that the baby is going to be vigorously eating every time the baby is supposed to eat during the first couple of days of life. If we can get the baby to latch and nurse at least every 2 to 3 hours, some feeds will be strong, some feeds will be weaker. But if we can get the baby into that feeding pattern, things are going to go well. The other thing is, don't hesitate to ask for help. You are not expected to do this alone. You were never designed to do this alone. Women were designed to be mothers as a collective group, whether that is our extended family or someone like a consultant or a midwife who you have asked to come along beside you and help you through this pathway of learning to be the mom. So be sure to ask for help. Use those folks that are in your circle to provide you that extra care that you need and that extra help to get you off to a strong and a lasting support.
Okay, so as we prepare to close out for this session, we thank you again for joining us. Please stay tuned. We will have a preparation for you on next week. It will be Thursday at 10:30, and that session will cover information about in the event that mom has to have a cesarean section, or some of our audience may be scheduled for C-section because they had one with their previous delivery. So we want to make sure you have plenty of information on that, and we'll also go over the anesthesia component if you have to have a cesarean section. And so that will be our next topic. And we plan to continue doing this at 10:30. As Ms. Selena was telling you earlier, we are working very hard to make sure that we publish all the previous sessions that we've prepared for you and post them both on our Midwives Facebook page as well as the hospital's intranet page so that you can go back and watch previous sessions that you may have missed. So we thank you again for joining us and hope to see you next time. Thank you.